Hello friends, I am Dr. Ashish Agrawal. I am a cardiac surgeon practicing in Aurangabad, Maharashtra, India. Today I am preparing a video for diabetes mellitus. This is a very common disease which is found all around the world and it's spreading like a fire and affects each and every individual. Initially it was thought that it is a disease of rich people, but nowadays even poor people or living in rural areas are getting affected with diabetes mellitus. In this, sugar level of patient increases due to lack of insulin, which is secreted from pancreas, an organ in our body. It can be divided into 3 to 4 types. Number one is type 1 diabetes. In this, it affects young children. There is less secretion of insulin, sugar increases, and such patients require insulin supplementation for treatment. It is seen in 10 to 15% of patients. Type 2 diabetes is seen commonly in elderly patient, adult patient. It is affecting 90 to 95% of patient. In this, we have to give oral medication because of increased weight. They get high sugar and they have a tendency of developing diabetes after delivery. The kids or newborn of this pregnant female can also get affected with diabetes mellitus. Other form is pre-diabetic, means your sugars are not normal, they are on the higher side, but you are not diabetic. But you have a risk of developing diabetes in future if you don't change your lifestyle. Now, what are the causes of diabetes? Number one cause is family. If family history, if your family members, one of your father, mother is having diabetes mellitus, then you are at a high risk of developing diabetes. Second is physical inactivity. If you are moving or having physical inactivity, then you can get diabetes. Other is your age is more than 40, then you have obesity, you have hypertension, you have dyslipidemia and post-pregnancy. These all things can lead to diabetes. How you will diagnose diabetes? First, you should know what is normal level of sugar. Fasting blood sugar should be less than 100 milligram and postprandial, that is 2 hours after meal, should be less than 140 and HbA1c should be less than 6. If your sugar HbA1c is more than 6, your fasting blood sugar is more than 125 and postprandial sugar is more than 200, then you have diabetes. What are the early monitoring signs of diabetes mellitus? These are frequency of urine, lack of energy, frequent thirst, frequent urination, UTI, urinary tract infection, then non-healing ulcer on the foot, then you have a tingling numbness in your foot and palms. And if you are above 40, then you are at the risk of developing diabetes mellitus. What are the complications? Diabetes affects each and every part of body. It affects your eyes in form of retinopathy. It can cause cataract. It can cause retinal damage. Then you can get a stroke, means paralysis, because it affects the brain. You can get an heart attack because it causes a choke up of your coronary arteries and you can have a heart attack. Then it can lead to affection of kidneys and you will land up increased creatinine. Then you may land up going for dialysis. Then you can have recurrent UTI, skin infection, the fungal infection, ulcers, gangrene, and ultimately you may land up with amputation of toe or foot. How to prevent it? The only way of prevention is proper managing diabetes mellitus. For that, you should have a good diet which will lead to weight loss if you are obese. So if you want to have a good diet should be of good protein content, less oil. There should be many fruits and vegetables. Fruits, you can have all kind of seasonal fruits and they should be in adequate quantity. They should not be too much. Even they are sweet, that sweet is fructose, which is good for health. But you should remember that should be in limited quantity. You should not have a ample of fruit every day. Next is you should have a full fruit. You should not take juice because while preparing juice you add sugar, salt, which can nullify the benefits of fruits. So fruit, vegetable and high protein diet is most important thing and most important part of your diet plan. Other thing is you should avoid dairy products like butter, then you should cheese, then shrikhand or sweet cheese, ice creams. This should be avoided. You should avoid meat. You should avoid non-veg. And if you want to eat egg, you can eat good quantity of egg, preventing yellow part, that is a fat. So you should not eat yellow part of the egg. Other part of diet should be your diet should not have sugar content or oil content. That should be prevented, and with this your weight reduction will help and control the diabetes mellitus. Other part is exercise. You should do all kind of exercise like brisk walking, 2 to 3 kilometers every day, to at least 2 times, morning, evening. You can do cycling, swimming, yoga, then Zumba. Then you can go for jogging. Light exercise will build up your muscle strength, and then you can have endorphin release, which will be beneficial for your body. Last part is treatment. You should remember that you should take treatment of diabetes from a qualified MD medicine person, doctor, which can diagnose properly and give you proper guidance for treatment. If he prescribes insulin, you should not be hesitant to start insulin. Any diabetes in the initial phase needs insulin so that it can take away the burden of secretion from your pancreas. It will be a short span of time when you will require insulin. So don't get afraid by insulin. Once your sugar level comes down, your qualified doctor will stop insulin and put you on oral medicine. You should not stop treatment without his permission or change any medicine without his permission. You should learn to monitor sugar on regular basis, at least once a week. You should do fasting sugar, postprandial, means 2 hours after lunch and 2 hours after dinner. You should prepare a chart and present that chart to your family physician, which will guide him to take care of your sugar levels. You should aim for weight loss. You should examine your body for any ulcers, any skin infection while taking bath, or you after the bath. Then you should change your lifestyle, that is yoga, then early sleeping and early getting up. You should have a sleep pattern of 6 to 8 hours of sleep. That will heal your body. You should have good eating habits, avoiding outside junk foods. Then regular health checkup every 6 months, so that your physician should know what is the status of each and every organ of your body, whether diabetes have affected the body organs. I think this is what I need to discuss with you, and I have prepared this video for your knowledge and good health. Thank you very much.